This is the Coronavirus Morning Report for Wednesday, April 15th, 2020. I'm Brian McCullough. Today, a surge of new official deaths in New York and some unusual categorization in Chile further highlight the vagaries of counting COVID. A look at New Jersey shows how even at this late date, simple testing is proving problematic. Businesses are looking to fill the testing gap. It turns out that Americans are actually pretty good at social distancing, and a look at the phenomenon of social distance shaming. The U.S. coronavirus death toll increased by 17% in a single day yesterday to more than 26,000. This came after the city of New York added more than 3,700 fatalities. The reason for this surge in fatality numbers was actually a bit of the vagaries of counting that we've been talking about. New York City officials now included the deaths of people who were never tested for coronavirus, but were presumed to have died from it. So it's not a case of suddenly a bunch more dead people were found overnight. It's merely that these were unfortunate souls who had fallen through the cracks of previous official counting. Quoting the New York Times, 3,000 more people died in New York City between March 11th and April 13th than would have been expected during the same period in an ordinary year. Dr. Osiris Bardot, the commissioner of the city health department, said in an interview, while these so-called excess deaths were not explicitly linked to the virus, they might not have happened had the outbreak not occurred, in part because it overwhelmed the normal healthcare system. Quote, this is yet another part of the impact of COVID, she said, adding that more study was needed. What New Yorkers are interested in and what the country is interested in is that we have an accurate and complete count, Dr. Bardot added. It's part of the healing process that we're going to have to go through, end quote. Actually, I want to explain these numbers a bit further. This is quoting from Talking Point's memo. The monthly averages suggest that more than 13,000 New Yorkers have died during the COVID pandemic than otherwise would have. Subtracting the 10,365 who have been designated as dying due to COVID gets another startling figure, 3,028 people dead. Those are all the numbers dead beyond the expected average for 2020, who haven't been identified as dying due to COVID, but who died as the city's hospitals hit their capacity limits and as ambulance sirens never stopped sounding in the city, end quote. With these new numbers, COVID-19 has killed more than 10,000 people in New York City alone, more than 3 times the death toll from 9/11, and far more on a per capita basis than have died in the entire country of Italy, which, as we know, is one of the hardest hit places. At the same time, as a further illustration of how you count things can really end up mattering a lot, Newsweek is reporting that the country of Chile is counting people who died of coronavirus as having recovered. The logic, or lack thereof, is that since these individuals are dead, they're no longer contagious, according to a Chilean health minister. Quote, we have 898 patients who are no longer contagious, who are not a source of contagion for others, and we include them as recovered. These are the people who have completed 14 days of diagnosis or who unfortunately have passed away, Chile's health minister Jaime Mañalich announced at a press conference, end quote. Children in Denmark are returning to school today after 5 weeks of coronavirus lockdown. Only 380 coronavirus patients were in Danish hospitals as of last night, down from 535 on April 1st, and the number of hospital admissions in that country remains far below capacity. India says it will begin easing its nationwide lockdown 5 days from today. The state of Alaska is allowing hospitals to resume elective medical procedures as a first step to reopening normal activity there. And the state of Ohio has announced that liquor stores in that state are now only allowed to sell to Ohio residents. Back in March, Pennsylvania shut down liquor stores in its state as a part of its statewide shutdown program. And Ohio now fears that many Pennsylvania residents have been crossing state lines to stock up on booze. Widespread, rapid, reliable testing is going to be a key part of reopening the country before a vaccine is available, but a new report in the New York Times suggests that the testing backlog in the state of New Jersey, as well as other parts of the U.S., is actually getting worse, not better. Governor Phil Murphy said at a recent news conference that the backlog in New Jersey is, quote, unequivocally worsening because of issues throughout the entire testing chain, from specimen collection to back-end processing, quoting from the New York Times. Initially, the strain came from a lack of test kits, but now there are not enough nasal swabs, not enough nurses. There is a pileup at the labs themselves and a limited supply of the chemicals needed to identify the virus, end quote. The piece in the Times paints a chaotic picture of tests being sent, sometimes by air, to various commercial labs around the country, all with long queues of tests to run because state labs have a paucity of capacity that was hit long ago. The piece follows what happens when people line up, often the night before, for drive-through testing at one of New Jersey's designated sites. By 11 p.m. Monday night, you're supposed to be in line for testing that commences at 8 a.m. Tuesday morning. Your sample is taken, a process that involves a swab to the very back of the nose or throat, and by mid-afternoon, the testing site this piece profiled had run out of tests. The workers packed up the hundreds of samples they'd been able to take for transport, but the local Quest lab was already overwhelmed with samples from nearby hospitals, including some in New York City, would have to be flown to a lab in Virginia for testing. By the time they're repacked for that transport, it's early Wednesday morning. Quote, at 1:24 a.m. on Wednesday, another van drove them to the airport across the street where a single-engine plane was waiting. The pilot, George Fendley, would be flying solo, as he did several times a week. If there ever were passenger seats inside the plane, they'd been ripped out, the coolers containing the testing materials filling the belly of the aircraft. It was less than an hour to Virginia, about 270 miles away, and the plane took off at 1:53 a.m. Along the way, Mr. Fendley flew into a thunderstorm and had to touch down in Pennsylvania. He took off again, trying to skirt around the lashing winds and rain. When he landed, it was 4:28 a.m. The samples got to the lab shortly thereafter. Then a lab tech loaded them into the machine, a laborious manual process. The machine then takes a few hours to process the batch of samples, and the results are then sent to a federal contractor who calls each patient back with the results. One more catch: to protect privacy, no voice messages are left. Instead, the patients must answer the calls directly. They get 2 chances to answer before the call center worker moves on to the next patient on their list. Clearly, the testing process outlined here is not yet running at a speed or capacity to be massively scaled up in preparation for, the reopening of the country. We return to the long mantra of this podcast: testing, testing, testing is the key. So what can be done to scale up testing? Some businesses are working on plans to run their own screening and testing programs in an effort to fill the public testing gap and get their workforces back on the job sooner. The president wants to reopen the country by early May, and Governor Cuomo of New York said recently, quote, rapid testing is going to be the bridge to the new economy and getting to work and restarting. We're not going to go from red to green. We're going to go from red to yellow. Yellow is let the people who can go back to work start going back to work. Well, how do you know who can go back to work? Test them. You have rapid testing capacity. We have to bring it to scale, end quote. Quoting from the Washington Post, 2 types of tests are in demand. One is a diagnostic test to determine whether a person has COVID-19, the disease caused by the novel coronavirus. Another, still being developed, is designed to tell if one has developed immunity to the virus. Both will be needed to ease the current U.S. lockdown. But even if the number of tests expands significantly, the nature of the virus and the design of the American workplace make coming up with a back-to-work plan difficult. The trend toward open workspaces means employees breathe the same air. Crowded elevators and public transportation pose perils. And in addition, employers must respect health privacy laws. But they, at the same time, need to share enough of that data if a worker has tested positive for the virus, and those in contact with that person need to be quarantined. Meanwhile, people who test positive for antibodies to the coronavirus could still spread it. And most COVID-19 testing still has high levels of false negatives, end quote. Workplace testing could consist of 2 steps. Step 1, temperature checking everyone who arrives at a work site or office. Although, as we know, asymptomatic people can carry and transmit the virus, so that won't catch everyone. So step 2 would be regular testing and contact tracing to quarantine those who are sick and those they've been in contact with so that everyone else can remain on the job. Amazon is one company working on a plan to test frontline workers, quoting from a recent blog post. Until we have an effective vaccine available in billions of doses, high-volume testing capacity would be of great help. But getting that done will take collective action by NGOs, companies, and governments. For our part, we've begun the work of building incremental testing capacity. A team of Amazonians with a variety of skills, from research scientists and program managers to procurement specialists and software engineers, have moved from their normal day jobs onto a dedicated team to work on this initiative. We have begun assembling the equipment we need to build our first lab and hope to start testing small numbers of our frontline employees soon. We are not sure how far we will get in the relevant time frame, but we think it's worth trying, and we stand ready to share anything we learn with others, end quote. Back to step 3 of our plan. A reliable antibody test. Companies and entire countries like the UK are pinning significant hopes on being able to test who is carrying COVID-19 antibodies and therefore who might be immune to the virus. But while there are lots of such tests in development, none have yet demonstrated the level of reliability to be widely adopted. Quoting again from the Washington Post, some say making Americans feel safe again requires wide-scale testing by public health systems, not just private employers. Scott Gottlieb, former head of the FDA, said that coronavirus testing should be as common as tests for strep throat. He said that COVID-19 tests should be done at every one of the 3.8 million weekly visits Americans make to their doctor's offices, not just when people show symptoms. It sounds ambitious to say everyone who presents to a physician should get swabbed, but it's not an unachievable goal, Gottlieb said. We're now testing 1 million people a week, so getting to 4 million a week is an achievable goal, end quote. It turns out that Americans are actually pretty darn good at social distancing. Bloomberg reports that the CDC previously estimated about 50% compliance with social distancing measures in the U.S., but new data shows compliance in America in excess of 90%, according to CDC Director Robert Redfield. Quoting Bloomberg, residents were surveyed in 4 cities, New York, San Francisco, Seattle, and New Orleans. About 80% of residents in those 4 cities left home daily at the end of February, the agency's report showed. 5 weeks later, on April 1st, just 42% of New Yorkers were leaving home on any given day. Fewer than half of those in San Francisco ventured out, while 52% of Seattleites and 61% of those in New Orleans left their homes daily. Those findings were based on the percentage of smartphones, watches, and other personal mobile devices that moved more than 500 feet away from their typical nighttime location. The data was gathered by SafeGraph, a company that posts publicly available information collected from anonymous location signals embedded in mobile devices. The researchers tracked more than 750,000 devices daily, end quote. While social distancing appears to be working, both in compliance and flattening the curve, it doesn't mean we can stop anytime soon. We can probably only ease up once the cases begin truly reducing every day, when the hospitals have enough capacity, when the hospital workers have sufficient personal protective gear, and yes, when we have accessible rapid testing for everyone. Use the internet with confidence from your computer, tablet, or smartphone with ExpressVPN. ExpressVPN has you covered on every device. Simply tap one button and you're protected. ExpressVPN encrypts 100% of your data with best-in-class encryption, so your information is always protected. Each ExpressVPN server has an IP address that's shared among thousands of users. That means everything you do is anonymized and can't be traced back to you. Even in incognito mode, your online activity can still be traced. Even if you clear your browsing history, your internet service provider can still see every single website you've ever visited. That's why even when I'm at home, I never go online without using ExpressVPN. ExpressVPN makes sure your internet service provider can't see what sites you visit. Being stuck at home these days probably means you haven't been thinking that much about internet privacy on your own home network, but actually this is the perfect time to sign up for that virtual private network you know you've needed to set up to protect yourself. There's never been a better time to protect your online activity today with the VPN that I trust to secure my privacy. Visit my special link at expressvpn.com/report, and you can get an extra 3 months free with a 1-year package. That's expressvpn.com/report. expressvpn.com/report to learn more. Obviously, for all our sakes, we need to avoid crowds in any way we can right now. But what if you need to go to the post office? What if you need postage to send out letters and packages? Don't worry, Stamps.com is here to help. Anything you can do at the post office, you can do at Stamps.com. Print postage on demand and skip those lines and crowds at the post office. Stamps.com brings all the services of the U.S. Postal Service right to your computer in the safety and comfort of your own home, office, or anywhere else you're hunkering down right now. Whether you're a small business sending invoices, an online seller shipping out products, or you're just working from home and need to mail stuff, Stamps.com can handle it all with ease. Simply use your computer to print official U.S. postage 24/7 for any letter, any package, any class of mail, anywhere you want to send it. Once your mail is ready, just leave it for your mail carrier, schedule a free package pickup, or drop it in a mailbox. No human contact required. It's that simple. Right now, our listeners get a special offer that includes a 4-week trial plus free postage and a digital scale without any long-term commitment. Just go to Stamps.com, click on the microphone at the top of the homepage, and type in briefing. That's Stamps.com, enter briefing. Stay safe, my friends. However, if that last segment didn't seem quite accurate to you, maybe it's because you have neighbors that seem to you to be ignoring all social distancing instructions. A lot of people seem to be wondering if and when it's okay to intervene when you encounter someone who isn't social distancing. Quoting the Wall Street Journal, social media has helped connect people during the coronavirus crisis, but as health authorities tighten their guidelines on public activities, platforms including Facebook and neighborhood app Nextdoor are turning into places for complaints and, in some cases, shaming incidents for people who think their neighbors aren't following the rules. The rift reflects a broader debate over whether public health overtakes civil liberties in the time of pandemic. Innocuous common activities have become neighborhood flashpoints, driving a kind of community surveillance to manifest online. The range of reported offenses runs from teens high-fiving on a basketball court and playing soccer at a school field to a mother entering a closed park with her sons. Some are posting photos of the children and have called the police, end quote. While ragging on neighbors isn't anything new, the high stakes of the virus are leading some people to speak up who otherwise wouldn't have. One woman who posted on Nextdoor about the mother who entered the closed park and was subsequently confronted by the mother on the app said, quote, "She said it's none of my business. But I think that when someone is circumventing the rules with this situation with COVID-19, I felt it was everybody's business," end quote. So public service or breach of privacy? Turns out that's a question we're confronting at every level of our lives during this pandemic, not just when it comes to things like contact tracing. Finally today, there's a big piece in The Atlantic that I suggest you all read, link in the show notes. It's one of those what comes next pieces. And the TLDR gist of the piece is basically the conclusion that I myself have sadly been coming to lately. Quote, "The only viable endgame is to play whack-a-mole with the coronavirus, suppressing it until a vaccine can be produced. With luck, that will take 18 to 24 months. During that time, new outbreaks will probably arise. Much about that period is unclear, but the dozens of experts whom I have interviewed agree that life as most people knew it cannot fully return. Quote, I think people haven't understood that this isn't about the next couple of weeks, said Michael Osterholm, an infectious disease epidemiologist at the University of Minnesota. This is about the next 2 years, end quote. And quoting again, everyone wants to know when this will end, said Devi Sridhar, a public health expert at the University of Edinburgh. That's not the right question. The right question is, how do we continue, end quote. Again, this is not optimistic stuff, but it's generally where I think we're probably at realistically. Yes, some states are probably going to reopen sometime next month, and probably a month or so after that, we will begin to see flare-ups, which will probably cause folks to go back into lockdown again, and that'll probably happen multiple times. And yes, even though I've spent a month or so trying to game out how testing and tracing could allow us to partially reopen, even with the possible cell phone apps and all that stuff, I don't see enough of this getting into place in time to be as effective as we need, especially with some states probably observing testing regimens strictly, while others probably will not. But in addition, adding to my pessimism, there were a few paragraphs in the middle of this piece that also made me realize we're probably not prepared for some of the second-order effects that we'll see this summer. What I'm talking about is kind of related to testing, but also kind of not. In short, even when that great day that we're all expecting actually comes, when case numbers and death numbers start falling several days and then several weeks in a row, that doesn't mean we're out of the woods yet. Let me quote, "Compounding these issues, testing companies all rely on the same chemical ingredients, which were already running low and are becoming even scarcer as the pandemic spreads. Trying to get these materials is not about dollars and cents, it's about physics," Osterholm said. "You can't just buy these things. It takes time to make them." To be clear, there is wide consensus that testing is crucial for working out where the virus is and adequately preparing for it. In an ideal reality, testing should be done extensively, but in this reality, Osterholm noted, it might be several months before manufacturers can meet global demand. For the summer, the U.S. might have to abandon the dream that everyone who gets sick is going to get a test, and we'll be able to count every case with a lab diagnosis, Wamblowski said. That might not be realistic, end quote. Crucial medical drugs are also running out. According to a University of Minnesota analysis, about 40% of the 156 drugs that are essential parts of critical care are becoming limited. Many of these depend on supply chains that involve China, where the pandemic began, Italy, the hardest hit region in Europe, or India, which halted several exports recently. These chains have been discharging their contents like a sputtering garden hose that has now begun to run dry. Quote, "The medium term is going to be particularly perilous," said Nada Sanders, a professor of supply chain management at Northeastern University. "Global demand is so high and supply is so far behind that it's very hard to envision enough of a ramp-up," end quote. Albuterol, the drug used in asthma inhalers, is scarce. Antibiotics, which control the secondary bacterial infections that afflict COVID-19 patients, are being depleted. Basic painkillers and sedatives, which are needed to keep patients on ventilators, are being exhausted. Hydroxychloroquine, the drug that Trump has repeatedly touted as a COVID-19 treatment despite a lack of good evidence, is running out, to the detriment of people with lupus and arthritis who depend on it. "It's like everything we give to patients we're in short supply of," said Esther Chu, an emergency physician at Oregon Health and Science University. "We're now scrambling to find the backup medications and we'll run out of those too," end quote. Meanwhile, of course, hospitals are still struggling. There aren't enough masks and gowns to adequately protect staff, ventilators to deliver oxygen to patients who can't breathe, or respiratory technicians and nurses to operate those ventilators. Overwhelmed and underprotected doctors and nurses are falling sick. In Michigan, more than 700 employees at one hospital have tested positive for the coronavirus. At another, 1,500 are out of work with consistent symptoms. Hospitals are now bringing back retired physicians, graduating medical students early, and retasking orthopedists and dermatologists to emergency rooms to help with the coronavirus surge. Even if cases abate in the summer, exhausted healthcare workers will have to catch up on elective surgeries that were postponed because of the pandemic and that are important to a hospital's financial survival, while also treating people who delayed getting help for heart problems, cancers, and other emergencies. Quote, "Patients are putting off health concerns that really need to be seen, and they're coming in sick," Chu said. If the pandemic rebounds in the fall, healthcare workers may have to greet it without having had a summertime respite. Hospital disaster plans, quote, "are all structured around a single discrete event that is over pretty quickly," Chu said. "We don't expect our diseases to be stuttering," end quote. These problems, the continuing testing debacle, the drying supply chains, the relentless pressure on hospitals, should temper any impatience about reopening the country. There won't be an obvious moment when everything is under control and regular life can safely resume. Even after case counts and death rates fall, the pandemic's challenges will continue and will not automatically subside on their own. After all, despite ample warning, the U.S. failed to anticipate what would happen when the coronavirus knocked on its door. It cannot afford to make that mistake again. Before the spring is over, it needs a plan for the summer and fall," end quote. That's all for today. I've been your host, Brian McCullough. You can follow me on Twitter at BrianMCC. The show subreddit is r/coronaviruspod, where you can tip us stories to consider for using on the show tomorrow. The show was produced by Ride Home Media, written by myself, James Welsh, and Jackson Bird, and edited by Jackson Bird. Be well. Talk to you tomorrow.